Well, the thing is I'm looking, and you can judge for the results of these patients, and we've done a lot of patients together now, and I want to have the patients look very, very natural. And to me, you didn't say the surgeon's name, so I'm not dissing any surgeon again,
Mm-mm.
but I find that oftentimes work that's been on the digastric can look overdone from my eye, like
Hmm.
trying to look at artistically what's going to give something that looks really natural and really beautiful. And sometimes it looks too sharp and a little unnatural for me. And some of the patients that you've sent me are some of those kind of people where they're pulled too tight, that too much has been done in the neck. And how do you go back and rescue something like that? They're very difficult.
How do you go
No,
back and rescue that?
well, no. How do you go back and put together the digastric when that fat, if too much fat is taken from underneath, as I showed you that first patient, I put
Right.
fat in people's faces not since today. I do it all the time. It's just that how do you go with somebody that's really scarred up, like the first patient I showed? So
Right.
that's what and a lot of the ones that you sent me, I think are really in a tough spot. Sometimes too much has been done.
Right. Can you go in and fix that? I mean, is there a rescue? There are a lot of we unfortunately have a lot of revision cases that find
Yes.
us and they find us too late because they've already gone to see a surgeon and things are overdone. So
Hmm.
I often, have these conversations every Friday morning with Dr. Sullivan talking about these complicated revision cases and talk to us a little bit about like what goes wrong and why sometimes there is no rescue with those types of cases.
Well, I think if too much skin has been excised or too much digastric muscle or too much fat or too much anything being done makes it extremely difficult to revise. Now, you sent me somebody who had a ponytail facelift, and I was able to do a ponytail rescue on that person, and I mean, you've heard from her. Is she happy?
She's very
Uh,
happy. Yeah,
yeah,
she's
right.
very happy.
And
There's different ways of going in and addressing the neck, and sometimes different approaches
right.
are not the right approach for the neck.
But at least that one wasn't so overdone that we could go in and we could get a very it was something that really worked well. We were able to revise it in a way that now she's very happy, and I'm delighted with those kind of patients.
Right.
So it's very much dependent on the physical exam. When you feel the tissue, is it rock solid like cement, or is it something that is there some softness there that you can work around?